Welcome to HealthLink Idaho. Among children born during 1994 to 2018, vaccination will prevent an estimated 419 million illnesses, 26.8 million hospitalizations, and 936,000 deaths over their lifetimes. Those are some impressive stats.
Yes.
Well, some staggering numbers that National Infant Immunization Week looks to share. So we're here with Dr. Christine Hahn to tell us more about National Infant Immunization Week and why it is so important to vaccinate our kiddos. So first of all, how are you today?
Fine, thank you.
Yes.
Feeling good.
Great.
Yeah.
Good.
So
Yeah,
let's talk about this big week and National Infant Immunization Week. What is this week all about?
Yeah. So this week is really a moment to stop and remember the importance of vaccinating our little kids. You know, especially with COVID, we've all been kind of blown off our routines and trying to remind ourselves that not only those of us that have little kids.
Yeah, I've got a 10-month-old.
That's right. So you're right. You're in the zone.
I am.
Yeah.
So you're in that age, but also there might be parents who have kids who are now 3 or 4, whatever,
Yeah.
and because of COVID, maybe they missed some of their appointments.
Sure.
So it's a good chance to go back and say, wow, did my kiddo really get in and get all those vaccines that I normally would have gotten them, but maybe the office was closed? And obviously, pediatricians are out there having their kids come in and reminding parents, but this is a chance for parents to look at the schedule themselves and make sure that they feel like their kiddo is up to date.
Okay, great. So the focus on infant immunization happens to be because of that potential backlog, if you will, of the time where we were kind of, you know, pausing life.
Yeah,
right?
COVID, yeah.
Exactly.
Yes, yeah.
Exactly. Some doctors' offices, you know, closed and said,
Yeah,
other
sure.
emergencies, you know, we don't want to see you right now. Of course, they're hoping to get those kids back in and get them all
Yes.
caught up, but this is a chance to think about that and focus on it.
And I know, you know, some parents, I think, kind of wonder sometimes, why do we vaccinate for diseases that just aren't as common anymore? You know, so why are the importance to make sure that we're still protecting against something that may not even really see exposure to?
Exactly. I think to me, polio is always a good example
Yeah.
of that,
Yeah.
right? The older generation, many folks in Idaho remember the day when polio was common. It was much feared. And in the 1950s, we got a vaccine for it. And really, since that time, most of us have been vaccinated. We don't see polio in the United States anymore. But a reminder that it's not gone just happened last year when in New York State they had a young man who had never been vaccinated, came down with polio, with paralysis. So that was kind of a wake-up call in the United States. We hadn't seen a case in a long time. When they tested the water in the area, the drinking water, the sewage, and kind of looked around, what they found was in the sewage water that they did see some evidence that polio was circulating. That not just that one person, but probably circulating. And we know that's the way that virus works. For every person that gets symptomatic and gets paralysis, there are probably many other people that got it, passed it on, never got sick. So those diseases are still out there. They're not gone, unfortunately.
What I really appreciated when someone explained to me that just because you don't see it prevalent doesn't mean it's not there. What it means is that the herd is being immunized. You know, we're getting our vaccination, so it's working.
Yes, exactly.
Right? It's an example of the fact that it's working.
Exactly.
Yeah.
How do parents keep track of, you know, I've got a 10-month-old at home, 3-year-old at home, I write my to-do list on a napkin half the time. And for parents to go, okay, am I up to date? Where can they go? And how do you keep track of all that?
Yeah, so you know your doctor's office always has those records. So does your local health department. They'll have those shot records as long as you have your kid in the registry, you know, which is optional. But many parents do it for either themselves or their kids. Like I have myself in the registry as well because I can't remember to keep up.
We have that little card.
Right?
It's somewhere in the diaper bag, but we can't remember where it is.
Exactly.
Yeah.
So now we have an app. You know, it's like one of those. Now we have an app for
Yeah.
that, but it is called Docket, and it's really great for parents who are getting their kids. Like, let's say you're at the point now they're going to enroll in school, and you're like, oh, I better check. The app will show all those records.
Oh,
it's
that's
secure.
so easy.
Parents can access it. We're not the only state using it. Other states have it in place. Of course, it's all. I find it extremely easy to use, and I'm not super good with the apps. So we do recommend people look at Docket. It's in most app stores, and that's something to do if you're, you know, certainly can still go to your doctor's office or go to your health department and get those records.
And really quick, too, it sounds like an app that would be beneficial for somebody who's maybe not even distracting their kids, but themselves because they travel a lot, right?
Exactly.
That's also another situation which you'd want to make sure that you're being immunized against potential other things in other countries.
Right. Traveling also for me and other healthcare workers, right? We're expected to get some more vaccines than most people because we might be exposed at work. So we have extra vaccines to keep track of. So it's very helpful in that regard.
Excellent.
Wonderful,
Thanks for the
wonderful stuff.
advice.
Thank you so much for the time.
Sure.
We'll have more Idaho Today coming up after the break.